Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med Surg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece. So take a breath, open your notes, and let's make the NCLEX feel a little bit less overwhelming. Let's do it together. Let's get started. So the NCLEX, it's broken into 15 specific areas. It's not just by knowing your content, it's about knowing how you apply in different situations. So those domains include the traditional 8 categories like management of care and psychosocial adaptation, like right here, and plus 6 steps of clinical judgment, which is a huge focus of the new exam. By organizing your notes around those 15 domains, you can learn how it plays them into the correct context for the exam. So here it's the pie that you need to complete for the exam, and here is the percentage. This is a short screen from a booklet from NCLEX website where you get the exam, and this is the CPR, the candidate performance report. And if you following along, you can see how I interpret all those little questions from this chapter, or every chapter, make one question from all of them, so you can see kind of to have an idea how this exam will be for you, and you can find where you are weak or where you are confident. Here, let me get my light. So here you see the NCLEX domains. I call them domain from the chapter, and here we have all 15, and I'm gonna take my light away and take a short screen, or just make a big glaze and see if you. I find out that many people are struggling with basic care and comfort, so I'm gonna read this first. It's manage pain, position for comfort, and ensure early ambulation. Under medicating for pain, prolonged bed rest, so this is like a red flag, and pain scale reposition every 2 to 3 hours. This it's a key. So when somebody it's from the surgery, and it's an outline, and also I specify in the previous chapters about this. It's repetitive. The pharmacological therapies is the administer analgesic antibiotics. So anti-nausea. So here we have like the PCA pump safety to identify for IV meds. Yeah, you will learn more about PCA pump on the RN skill lab. It's a fun day at a time when you learn. And giving opioids before confirming the respiration and the lack of the level of consciousness, wrong antibiotic timing. So this you need to pay attention. It's all about pain, vitals, airway, ABCs, and bleeding. Okay, so moving forward. We have a hypothetical case study. Mr. Alvin Moore, it's just a name, a 68-year-old male with a history of COPD and type 2 diabetics, underweight, underwent an elective open cholecystectomy. He is now in the PACU phase 1. So in the terminology video, you will learn what is the phase 1. Phase 1, 45 minutes post-op. He received general anesthesia. We know from previous chapter the main 4 types of anesthesia. So this is one of them, general anesthesia, and is currently semi-awake, reporting pain at 7 out of 10, 10 being the worst. His respiration is 10 respiration per minute. O2 sat it's 90 on 2-liter nasal cannula, and he is shivering. Shivering, that means has chills. So it's hypothermia. His abdomen is distended and he has not voided. The surgical dressing is intact but slightly bloody. An IV PC pump with hydromorphine is initiated. We have question 1 category, so it's safety and psychological integrity. What are the immediate nursing priorities? Because it's safety for our client patient in PACU in phase 1. So increase O2 to 4 liter and place in semi-Fowler's position. Notify the surgeon about shivering. Assess airway, breathing, and circulation. Initiate incentive spirometry. And the last one is monitor response for PCA use. So what do you think is immediate nursing priorities while it's in PACU? Assess airway, breathing, circulation, so ABC. So the correct answer is C. The rationale of this is tachycardia and hypotension are classic signs of internal bleeding in the post-op patient. Those require immediate notification of the provider to prevent deterioration. Pain and urine output should be monitored, but those do not signal immediate danger. Question 2. So here we have a different domain. Which of the following assessments require immediate nursing intervention? So this is an assessment. Earlier was about safety. Pain level 7 out of 10. Respiration 10 respiration per minute, and O2 sat 90. Abdominal distension, slightly bloody dressing. So again, it's the respiration, it's ABC. A respiration rate of 10 breath per minute, it's bradypnea, and O2 SAT-90 indicate respiratory depression and potential hypoxia, which require immediate nursing intervention. This is a priority APC issue. Question 3. We are again in the safe and effective care environment. So here it says drag and drop the steps in order of priority for responding to Mr. Moore's its client respiratory status. So first you elevate the bed. Second, you reassess, apply oxygen, call anesthesia if responsive. So what are your steps? It's very common to have this in NCLEX. So it's elevate the head of bed. Then you apply oxygen. You don't let to sitting down. You need to elevate. Then you apply the oxygen. Then you reassess the respiratory. If you give oxygen, you need to know if it's effective or not. And then the D, you need to call anesthesia if unresponsive. So this is a priority sequence aligns with postoperative respiratory management protocols, specifically in Davis Advantage in my book that I'm reading. 4, this is a different subcategory. What nursing action are appropriate? So here again, nursing action. You don't do immediate, but this is what you do, action. So to understand more about actions, you review on each chapter. They have under nursing management, they have assessment, action, teaching. They have all their excuse me, they have their more specific in the book, so you just glance there and you read. And there means this health promotion and maintenance, the nursing action, so that little paragraph. And here we have select all of the apply. Encourage deep breathing and coughing. Monitoring blood glucose levels. Keep patient NPO for 24 hours. Turn patient every 2 hours. Delay ambulation until the next day. So you encourage deep breathing and coughing. It's very important. Monitor the blood glucose levels, especially with his diagnostics. Then turn the patient every 2 hours. It's very important, the positioning, because he's still in bed. And delay ambulation until next day, you don't do this. And you keep the NPO for 24 hours, you don't. You try to encourage to take zips. You encourage to take small sips of water and little by little. Okay. Encourage deep breathing and coughing. It prevents pneumonia by promoting lung expansion and secretion clearance. I'm choking on this question. I can't believe. Monitor blood glucose levels, essential for surgical patients, especially if diabetic or stressed, to prevent infection and delay wound healing. And D, turn patient every 2 hours, reduce risk of pressure injuries, and for the venous studies. Question 5. What should a nurse teach? Here is the teaching. Remember I said about nursing management on the chapter, and there they have teaching. So what should a nurse teach? If you want to know more, you go and grab that, open the book for, and you know it's psychosocial integrity. Family during the phase 2 recovery. On terminology, I was talking about phase 1, 2, and 3. An outline, so you'll know what means phase 2. A, how to remove surgical staples, purpose and use the PCA pump, sign of infection to report, how to ambulate independently with IV pump, signs of infection to report. So during phase 2 recovery, the focus is on preparing the patient and family for discharge and self-care at home. Teaching should emphasize complication prevention and early detection, especially redness, swelling, drainage, fever, foul odor, or increased pain at the surgical site. Those are classic signs of infection that must be reported promptly. 6. Which potential complication is most associated with the patient history and current presentation? So you see psychosocial adaptation, how, what is the potential complication. Here I have your answer already. It's C, respiratory depression, giving the context opioid use with PCA, low respiratory rate and low O2 sat. Respiratory depression is the most immediate and life-threatening complication. Opioids used for post-op pain control, especially PCA, depress the respiratory center in the medulla. So our patient respiration of 10 per minute and O2 sat 90 are signs of early respiratory depression. So let's have another example. We have a patient, a female, 72-year-old female with a history of hypertension and mild chronic kidney disease, underweight, a total abdominal hysterectomy. So she's now in PACU phase 1 hour post-op. She received general anesthesia and is currently drowsy and arousable. Her respiration is 10, O2 sat is 91 on 3-liter nasal cannula. and the blood pressure is 98/56. Her abdomen is soft, but she hasn't voided since surgery. Pain is 8/10 and she is pressing her PCA frequently. Her surgical dressing is dry and intact. The family is waiting for updates. Select all of the apply question. Which of the following are priority nursing intervention? Nursing intervention again. Here you will know more in detail if you open the book under nursing management, where they have assessment, intervention, action, teaching. So nursing intervention for our patient in the immediate postoperative period. So raise the head of the bed to semi-Fowler's position, encourage early ambulation, assess respiratory rate and sedation level frequently, stop PCA immediately due to high pain score, monitor blood pressure and oxygen saturation, notify the surgeon that the patient has not voided. So you need to raise the head of the bed, assess the respiratory rate and sedation level, monitor blood pressure and oxygen saturation. So positioning, sedation monitoring, and hemodynamic support are immediate PACU priorities. Pain alone does not warrant discontinuing PCA. Voiding concern is premature at 1 hour post-op. On the question 2, for each of the following assessment findings, select whether the nurse should intervene immediately or continuing monitoring. So here we have the findings from our case. So here is the finding, like the first one, it's we intervene immediately for the O2 sat. We continue monitoring for pain, slightly abdominal bloating, we still monitor for that, and we intervene for the 10 breaths per minute. So oxygen, like ABC, it's priority. Complete the sentence using the most appropriate choices below. Maria's low blood pressure, sedation, and slow respiratory rate place her at risk for answer choices. Which is a possible complication of administered via PCA? So the respiratory depression and opioid analgesia. So the PCA delivered opioids can depress the respiratory center, especially in older patients. 4. Identify the condition, action, and parameters to monitor. So here you have like central issue, postoperative, respiration depression. So this is like a bow tie model, targets critical decision making during sedation related respiratory compromise. So condition is the respiratory depression. Action, you raise the head of bed, administer oxygen, call anesthesia if unresponsive, monitor respiration, O2 sat, sedation level. 5. Which factor increases Maria's risk for delayed recovery from anesthesia? Use of spinal. So which factors increases? use of spinal anesthesia, PCA, initiation in PACU, advanced age with kidney disease, early removal of oxygen support. So it's advanced age with kidney disease, older adults with decreased renal clearance may have prolonged drug effects and delay emergence from anesthesia. So we are almost at the end. Which is the most appropriate education to promote to Maria's family while she is in phase 1 recovery? So it's education, it's teaching. Instruct them on how to restart the IV PCA. Explain that the patient is stable but needs close monitoring. Ask them to help reposition the patient in bed. Provide instruction for discharge medication. Explain that the patient is stable but needs close monitoring. Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing students who might need this too. Everything we cover connects back to the real nursing, whether it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.